My name is Dr. Clara Roberts. I am a neuropsychologist and licensed clinical psychologist with Lovelace Medical Group. I completed a Master's of Science in Psychological Science from Seattle Pacific University, as well as a Ph.D. in clinical psychology from the same university. Then I completed a 1-year health service psychology residency from a VA medical center in Jackson, Mississippi. And lastly, a 2-year postdoctoral neuropsychology fellowship from a private practice here in Albuquerque. Neuropsychologists study the connection between the brain and the mind. So the brain being the physical structure and the mind being its function, what it does in terms of your behavior, your emotions, and your thinking skills. And what we do is evaluate patients' cognitive skills or their thinking skills and determine kind of what's going on. People have been noticing some declines or changes in their thinking, whether it's due to an injury or a medical diagnosis. And so we evaluate where they are in terms of their various areas of thinking and then come up with a diagnosis and a treatment plan. We do cognitive testing, so the patient comes into the office and they'll actually be working with my psychometrist, Lauren, and we do lots of different kinds of tests. So we look at areas like attention, concentration, memory, language skills. A lot of the tests are kind of like puzzles or games almost. They don't necessarily always feel like tests, but it is an in-person evaluation. It is a 3-part evaluation. So the first part of the evaluation is an intake interview, so a chance for me to get to know the patient a little bit, kind of their brief life history, any psychological treatment or concerns they might be having, as well as why they were referred, what brings them into the office. And then the second appointment is the cognitive evaluation, where we test their thinking skills, so memory, attention, concentration, those kinds of things. And then we meet one more time for a feedback session to go over all of the results, discuss anything that we might have found, and then if I have any suggestions, either things that I think the patient can be doing differently at home, or if I have any recommendations for the referring provider as well in terms of changes to their medical care. So I see patients over the age of 18, all the way up to 100 plus. For the younger patients, so the people under the age of 65 or so, it's generally people who are concerned they might have ADHD, maybe they had a moderate to severe brain injury, a neurological illness, so for example, Parkinson's, multiple sclerosis, epilepsy, those kinds of things. And then for the older adults, the over 65 crowd, it does tend to be more a dementia diagnoses. They're having some concerns with their memory, so differentiating between the different kinds of dementia is generally what we do for the older patients. I don't just look at people's social histories, their psychological histories. I also look at any co-occurring medical conditions that I think might be contributing to any cognitive problems they might be having. A sudden and significant change in thinking skills, whether that's memory, attention, concentration, language. The patient was doing well, and then all of a sudden they start noticing these changes in their cognition. That's generally a sign that they might benefit from a neuropsychological evaluation.